Secretary Kennedy, I'm sure you're aware that Black women are at least 3 times more likely to die from pregnancy-related causes than white women. The vast majority of those deaths are preventable. Black women in my district are more likely to die during pregnancy than their peers in 97% of U.S. cities. Your written testimony mentions maternal and child health 4 times, but from what I've seen, the NIH canceled grants researching Black maternal health. Your administration's fiscal year 27 budget proposes eliminating Healthy Start, which is one of the federal government's primary community-based maternal health programs. And you've made it a priority of HHS to end diversity, equity, and inclusion. So yes or no, my question for you is, if a medical school or a public health school educates students about addressing the Black maternal mortality crisis, would you consider that an illegal DEI?
No.
No, you would not?
No.
Great. I do hope for the medical schools, the universities, and the accreditors, your administration has been threatening that they're watching this and take this directive to continue teaching about and addressing the Black maternal mortality crisis. And I expect your agency to restore and expand funding and support for that work. Also, yes or no, do you think consuming more protein and avoiding Tylenol will prevent Black women from dying 3 times more likely during a pregnancy?
I doubt it. Tylenol doesn't kill you.
So then why aren't you putting forth serious policies that actually address the health crises in this country instead of just these unserious conspiracy theories and this wellness influencer mess that we brought?
Do you want me to answer that question, or are you just talking?
No, it's a question.
We are doing more on maternal health than any other administration.
No, I said Black maternal health.
On maternal health.
Black maternal health.
That includes Blacks and whites.
But the thing is that they're actually not the same outcomes, which means that we need specific and intentional interventions for Black maternal health and Black infant.
Can I finish? I'm saying.
Are you going to answer that?
Yeah, we have right now, we've implemented a perinatal pilot project that we're in 220 hospitals around the country. And we have reduced maternal health mortalities by 42% at those hospitals by providing them protocols.
Can you please share what the reduction has been for Black maternal health?
Across the board, it's 42%.
But Black maternal health still has worse outcomes than other people.
I wouldn't know. It helps everybody.
But it isn't.
Object to that?
Okay, thank you. It is not. I do want to just, for the record, state that. It does not help everyone. Your agency told programs to remove a list of nearly 200 words and phrases from their funding applications, including the word Black. Do you have an idea of how we could solve the Black maternal mortality crisis if we can't say Black?
President Trump is trying to end division in this country, not so division.
Not eviction.
During the last 4 years. That's what DEI did. It divided people. It polarized people.
No. We're not talking about eviction. We're talking about health care.
I'm calling about DEI.
We're talking about health care.
Yeah.
Disparities. So what we're asking is if you attack DE&I and then we have a crisis that impacts one population over another, but you cannot direct specific spending or research or interventions to that population, how do you solve the problem?
Do you think the federal government should be paying for DEI?
I think the federal government has a vested interest in ensuring that its citizens survive childbirth.
Well, we are meeting that obligation.
We are not.
Oh, that I can explain to you how we are.
You have not done so far. But also I would say that, we can improve health care for everybody at the same time as helping the people who are most likely to die. That's what DE&I, well, first of all, DE&I makes sure that we have Black doctors or women doctors. Or that we're talking about the fact that we have a mortality rate that is not matched by any other country as what we would call developed as ours.